I'm George Thompson. I'm a professor of infectious disease here at UC Davis Medical Center in Sacramento. And most of my time, clinically and research-wise, is dedicated towards invasive fungal diseases, one of which is valley fever that's been in the news quite a bit over the last few years.
And can you tell us the current state of valley fever in California right now, particularly in areas that's more prominent, maybe like Central Valley?
Yeah, we've seen a big increase in the number of cocci cases over the last 2 to 3 years. Um, the Central Valley looks like there may even be a 200% increase in cases over the last year in some areas. And then we're really concerned that it's become more virulent. And what I mean by that is some of the patients really appear to have more aggressive disease. We haven't typically had this many patients with valley fever in the ICU at one time. And we've talked with other sites in Northern California, and they're seeing the same thing. So we're concerned that not only are there more cases, but there's more severe cases.
So can you tell me a little bit about some of these severe cases? What are the symptoms that these patients are presenting?
So the majority of people with valley fever have some type of a respiratory illness. So some of those most severe manifestations are really bad pneumonia. So those are even people on the ventilator or that need assistance to oxygenate their blood. And so that's sort of the most severe pulmonary manifestation. But in about 1% of people, valley fever will leave the lungs and go to some other site, skin, bone, or brain, and cause meningitis. And we've seen more meningitis cases over the last few years as well. Those can be really challenging to take care of. Often with the current antifungals we have, some of those patients don't respond to any agent, and that's really a challenge for how are we going to improve these patients. And we've had to resort to things like immunotherapy, trying to augment the patient's immune response since the antifungals have not worked. But it's an ongoing challenge and an area with a lot of ongoing investigation, and we're hoping to still help that small percentage of patients who don't improve.
Can you tell us a little bit about how California's droughts and dry weather conditions can contribute to the spread of valley fever?
Yeah, so in the soil, coccidioides exists as sort of a mold form, and during periods of heavy precipitation, when we get a good amount of rainfall, we think it grows into a higher quantity within the soil. And then during drought conditions, every other cell dies and spores are formed. And those spores are what we breathe in for the infectious form of coccidioides. So it needs this sort of heavy rainfall followed by drought to propagate its life cycle. And then, long droughts are associated with fires, of course, too. So we're still sort of working on, are those fires related to valley fever or just coincident? But fire can create its own weather. It kind of updrafts air, and we're concerned that that large updraft might throw valley fever into the air and really facilitate spread into the surrounding region.
So that will be kind of an interesting investigation for your department over the next few years as the fires grow more and more in California and valley fever coincides with it.